Dennis Long, Sports and Regenerative Medicine Therapy. I treat a lot of athletes, and one subset of these athletes is martial artists, and we treat a lot of knees. A particular athlete we had was an older gentleman who had been training all his life in karate, and he had really bad knees. And I'm going to show you a little picture of an x-ray of a knee. Now, when you have the femur and the tibia, they articulate in the knee joint. You'll have a outside joint, which is where the lateral meniscus is, and an inside joint where the medial meniscus is. This illustrates a very severe form of arthritis where you have narrowing of the medial joint. This is very difficult to treat when it's this narrow. If you have a little bit of space left, such as here, you can help build upon this and repair. And we've had some very excellent luck with our athletes. It's dependent upon many factors, their age, their health, but in a lot of these athletes who are older, they're in very good health. This particular person was 80, and after we treated his knees with stem cells, he actually performed the splits for us. So not only was he limber, but he was feeling good enough after doing the splits that he wanted to show that off for us. I treated both of my knees 9 years ago, and I drove a stick shift afterwards. So it's not that very difficult. A lot of people are very afraid of it and think that it's some difficult thing. It's not like having surgery. It's a walk-in and walk-out procedure. There are no pain pills. There's no crutches. It's actually quite easy. Thank you.